Good morning, everyone. Today, I am excited to talk to you about ways to prevent diabetes and other chronic health conditions. Diabetes is a serious health condition that affects lakhs of Indians. It is a chronic condition that can lead to a serious complications such as heart diseases, strokes, blindness, kidney diseases, and nervous damage. Fortunately, there are steps that can prevent diabetes and reduce our risk of developing the condition. Eating a healthy diet and exercising regularly are two of most important points. Eating balanced diet and limiting or avoiding processed and sugary foods can help maintain a healthy weight. Regular physical activities helps your body to use insulin more efficiently and can also help you maintain healthy weight. It is also important to get regular medical checkups or screenings and talk to your nutritionist and doctors about your risk factors for diabetes. Diabetes can be prevented, and taking steps to reduce your risk can help you live healthier and longer life. Thanks for joining us today, and I am looking forward to any questions you may have. Meanwhile, I'll also introduce to our guest, Dr. Anjali Hudagaru. Let me share a few words about her. It is my pleasure to introduce our keynote speaker today for this webinar, Dr. Anjali Huda. She is a highly qualified and an accomplished physician with a wealthy of experience in the field of nutrition and obesity medicine, and she holds a MD in internal medicine from the United States, and also she completed fellowship in obesity medicine and nutrition support. She is also a certified functional medicine practitioner in India. She has 9 years experience in India before moving from US. Her expertise includes maintenance of obesity, thyroid disorder, diabetes, hypertension, and cardiovascular diseases, PCOD, and other lifestyle diseases. She is currently the director of Live NutriFit Center for Obesity and Longevity as well, which is located in New Delhi. She has dedicated her career to help people improve their health and well-being through personalized nutritionist and lifestyle interventions. She is a respected authority in the field of obesity medicine and has helped countless individuals achieving their weight loss and health goals as well. Her deep understanding in the science of nutrition and her expertise in functional medicine, Dr. Anjali Hudagaru is a unique qualified to provide guidance and support for those who are looking to improve their health and wellness. We are honored to have her on as our keynote speaker and looking forward to her valuable insights and guidance she will provide to us. Thank you, Anjali Hudagaru, for joining us today.
Thank you.
Yeah.
Thank you so much.
Yeah, I'm handing over to you, ma'am. Before I go to the question and answer session, I would like to give some brief about how we can prevent diabetes, what causes diabetes.
I thank you very much, everyone, and for so much respect and such good words. Yes, I am practicing in reversal of diabetes a lot. I think India is becoming it's almost like a pandemic, like the diabetes. So my work started as only, as a weight loss physician, but I started seeing a lot of diabetes in India, diabetes plus obesity called diabesity. It's becoming very common. It's like 1 in 5 having a high waist circumference. So, and when you test them, we find that there could be either pre-diabetes or diabetes. So my work has now become focused on prevention of diabetes as well as treatment and reversal of diabetes. And I think food is medicine from my point of view. And if you can improve that aspect of your life, I think most of the diseases can be reversed. So I work on the basic principle of food is medicine. Of course, I use allopathic and botanical medicine as and when required, but mainstay of my practice is always food is medicine. And I'm sure you will appreciate after this talk when we talk about how to prevent and how to treat diabetes in patients with even the chronic issues. Thank you very much, and I will be ready for all the Q&As.
Thank you, madam. Thanks for brief introduction. Let me share the questionnaires.
Yes.
We have the first question in the screen, ma'am. Let me read out for everyone. Is it safe to use sugar-free products for the diabetic people? If yes, is there any limit to consuming them? Is pure honey safe for diabetes? There are two
All
questions
right.
involved in it.
Yes. So
By
first
Suresh.
question, is it safe to use sugar-free products? I feel you have to get off the taste of sugar. Sugar is a developed taste. And using sugar-free products, you're only harming your system and only telling your system, it's like, tricking your system to feel that there is sugar and there is no sugar. So even though people will use sugar-free products, the insulin will still spike in most of the people. So I'm quite against the sugar-free products, although I have been a victim of consuming them myself at some point till I didn't know how bad they are. And having sugar-free tablets in coffee, tea, I think it's more important to watch out for other things in your food rather than going for sugar-free products. And yes, there is a limit to consuming them. You may have one cup of tea with a sugar-free tablet, but if you're going to do that every time and you're going to replace your you basically not changing your tongue taste buds, you're just tricking your body. So I think the limit is there should be no use. And is pure honey safe for diabetes? Pure honey is fine. Pure honey also has probiotics. It's okay. So once in a while, if you want to have honey in place of any sugar, or you want to have some taste to your tea, coffee, or whatever you're having, honey is a safe alternative, but also has to be consumed in very, very limited amounts. One teaspoon to 2 teaspoons a day should be more than enough.
Okay, ma'am. Thank you. Thanks for that, ma'am. We'll move on to the next question. I hope Suresh Garu has got the right answer for this. Second question on the screen, ma'am. What is the reason for numbness of the legs and fingers during diabetes? What are the other serious signs of diabetes and how to overcome it? Shanti.
Okay, so Shanti, thank you for this question. The numbness of fingers and legs and fingertips is happening because of there is a nervous damage due to microcirculation being damaged during diabetes. So you have to understand that when you're on diabetic medications, your B12 also goes down. So if you're not somebody who's supplementing with B12, if you're especially if you're a vegetarian, you need to watch out for that because there is a nervous system damage due to diabetes. So make sure your diabetes is controlled and make sure you are having the B12 supplementation depending on the levels, blood levels. And you have to, and this is end organ damage for diabetes, like kidney disease or eye loss of sight. So nervous system damage is also very important because it shows that your microcirculation is getting damaged. So you need to either improve the diabetes, and I'm telling you, if you improve the diabetes, these kind of signs can go away, and you can also treat it with medications and of course supplements. And medications, I will limit my talk not to go into what kind of medications because I don't want to give a advice on medications right now because it is a very general advice I'm giving. But you can have medications to improve your nervous system.
Thanks, ma'am. And we'll go to the next question. Third question is best and worst food for type 2 diabetes.
It's a very good question, and it's a very vast question. And best food for diabetes, I would say, is protein in intake, and also taking lots of fiber and good fats. And the worst food for diabetes type 2, I would say, is sugar and carbohydrate consumption. the more sugar and more carbohydrate you consume, it's like a vicious circle that you go into. If you're not controlled, then you will have the cravings for sugar. So you have to manage the control and yet keep enough proteins in your diet to balance out the sugars. Proteins is the most important thing. And of course, getting good amount of fiber in your diet through vegetables or through other sources. And very, very important to also have good fats, because good fats are actually very filling, and they kind of have a longer gastric emptying time, so you can feel more full with those foods rather than having simple carbs, and which immediately get burnt off, and you want more. So carb attracts carbs. Remember that.
Yeah, thanks, ma'am. Thanks for that beautiful answer for that. We'll move on to the fourth question, ma'am. If a person has necrosis and diabetes and vascular veins, what foods can we include? Durga Chaudhary. By this question also.
Yeah, it's again a very it's a very in-depth question. I think patient who has necrosis and diabetes and varicose veins. So varicose veins may not be related to diabetes most of the times. They can be due to poor venous circulation. And necrosis, I'm not sure what part of necrosis we're talking about. Diabetes, people do have issue with end organ microcirculation damage, so they can develop gangrene and stuff. So the rule will be applied as to question number 3, that you need to have good amount of proteins, fats, and fiber in your diet, and lower the carbohydrate to control the diabetes. Of course, medications are also very important at this point, but as I said, varicose veins may not be related to diabetes. But if a patient has a diabetes which is out of control, very important to do protein, fiber, and good fats.
Okay, thanks, ma'am. Thank you very much for that question. And we'll move to the next question. Can I do intermittent fasting to control my diabetes? By Raghu.
Hi, Raghu. Very good question. Intermittent fasting can be done to control diabetes. Make sure you're not on insulin or you're not on some oral hypoglycemic medication that may bring your sugar down while you're fasting. So when you're fasting, you have to be mindful of the hypoglycemia, which means lowering of blood sugar less than 70. So if you're doing intermittent fasting, you should be under the care of a physician to make sure that your medications are adjusted exactly how you want to do it. But I feel intermittent fasting can be a great way to lose weight, control diabetes, and mental health, and lot of things happen with fasting. So fasting is great, but you have to be very careful.
Okay. So the sixth question is, I'm diabetic and my pancreas is removed. What type of measure should I follow? By Parsuramaya.
Hi, Parsuramya. Good question again. Very, very creative questions. If your pancreas has been removed or your pancreas becomes inactive due to long-standing diabetes, you will have to be on insulin, you understand. And when you're on insulin, then you have to measure you have to understand that your requirement of insulin doesn't go up. A lot of people I know, a lot of patients, what they do is they eat a lot of sugar and carbohydrates, but they will increase the insulin quantities. But that is what we should not do, because insulin, please remember, can also cause weight gain. It's anabolic hormone. So if you are somebody who is dealing with a lack of pancreas and you are on insulin, make sure that you are controlling your carbohydrate intake as well at the time of insulin. And then, of course, same thing I'll say as question 3 and 4, that please maintain good protein levels in your blood, depending upon your kidney functions, of course, and please maintain a good fiber level, and stay hydrated, and have good fats in your diet up to 30%, 25 to 30% of the diet should have good fats.
Thanks, ma'am. Thanks for that question, for that answer. And I hope Parsuramaya garu got the answer for the question. And before I move into the seventh question, ma'am, I would like to give some brief about our Nutrifil. Like all these questions which are answered by our renowned nutritionist cum physician, Dr. Anjali Huda garu. And apart from that, ma'am, we have also 6 nutritionists in place. So not only in this webinar, in the future also, if you can sign up with our platform, and you can ask, and you can control your diabetes, weight loss parallelly with our application as well. So we are here to help you with the nutritionist, expert nutritionist, and nutraceuticals as well. Yeah. So I think our team has posted the links and social media links and app links in the chat. You can take a look at them and download our application. It is free to sign up by using your phone number. And not only with the app application, we have also web WhatsApp chatbot. You can sign up there as well. Okay. So with this, I would like to move on to the next question, 7th question. Ma'am, the 7th question is, I'm having diabetes and IBS. What type of fiber food can I include? Nagachari.
So diabetes and irritable bowel syndrome can exist. I'm hoping this is IBS means irritable bowel syndrome, not inflammatory bowel syndrome. So if you have IBS and you have a constipation dominant or a diarrhea dominant, depends on what kind of IBS you have. But you have to understand that with diabetes, long-standing diabetes, your motility of your gut goes down. So you mostly will likely experience more constipation side effects than diarrhea. And in such situations, ample fiber is very important. But if you have a diarrhea-like picture, I would say low FODMAP foods, which is low fiber. But for people with constipation dominant IBS and diabetes, which can happen very commonly, I think good fiber is very important. You can have psyllium husk, or you can also have fiber from your vegetables and whole grains. I think that would be very important to treat the IBS, because as I said, it's an irritable bowel syndrome. So you don't want to irritate your gut. You want to feed it good food, and the good fiber you feed to your gut, the more microbiome of your gut becomes better. So you get more good bacteria. So the better the bacteria, the better the digestion and better constipation. But also remember, sometimes you will have to put patients like this on probiotics for a span of time.
Okay. Thanks, ma'am. So the next question is, how should I control my routine diet and sweet carvings? Ramakrishna, by Mr. Ramakrishna.
Routine diet and sweet cravings. Make sure that you don't have sweet cravings due to high insulin levels. That's usually the case. But if you are having high sweet cravings and in routine you're not applying enough protein or good fibrous carbs and vegetables in your diet, I mean, the rules remain same. So make sure that you're doing all that. And still, if you have sweet cravings, then you need to watch out for insulin resistance, or maybe there is diabetes and you have not been tested for it.
Okay, ma'am. So which means that while the patients are taking insulin, will have this sweet carvings, right, ma'am? Because of that insulin.
Patients will have patients on insulin. I thought we were talking about patients not on insulin treatment. Yeah, patients not the routine diet and patient not on insulin, you can have sweet cravings due to underlying pre-diabetes or high insulin circulating levels. So that needs to be watched out.
Yes. Yeah. And 9th question is from Mr. Praveen, and he's 32 years old, and he's following a ketogenic diet for weight loss for last 6 months. And recently he diagnosed with pre-diabetic condition. So he's asking, should he continue the ketogenic diet now, or he has to hold?
I think you can continue with the ketogenic diet. It'll only help you in reversal of diabetes. Make sure you're doing it under supervision, because I don't see a reason why a ketogenic diet plan would lead to pre-diabetic condition. So there is something that maybe you're doing wrong. So you need to get help of a professional here. Otherwise, ketogenic diets actually will treat diabetes.
Okay, so he can continue that ketogenic diet actually.
He can.
Yes. Okay. so we have another question from Miss Madhavi, and her question is, what is the best liquid diet for diabetes? Because she's pancreatitis patient, and doctor suggested having liquid foods. Actually,
Wow, this is a very, very extremely medical ICU question.
okay,
But if you are a diabetic and you also have pancreatitis, which means inflammation of your pancreas, which produces insulin, then of course, if you have been advised to have liquid foods, then make sure they are low in carb. And sometimes pancreatitis patients have to be actually given bowel rest. So I'm not sure where you are in that, because I know I've given a lot of pancreatitis patients total parenteral nutrition for a while to give the recovery period. So if you are on liquid food, I think your doctor should suggest what kind of liquids should it. I mean, it definitely is low carb, but it should be suggested by a doctor whether it should be high fiber or not, because you want to give your uh, intestinal rest period. So I don't know which stage of pancreatitis you are. So I don't. I mean, I'm sorry. This is a very, very focused question. Need to know more about this patient before I can give a general advice.
okay. So Miss Madhavi, please take the proper guidance from your physician or the nutritionist who is giving suggestions, ma'am. Actually, because we
Yeah,
can't give a generalized suggestion as this question is
this is
very
not generalized. No. Yeah.
yes, yes. Yeah. So we'll move on to the next last but one question, madam.
Mhm.
So this was by Mr. Srinivasulu.
Mhm.
He's a diabetic and he can't do exercises. So he's asking what are other measures to control diabetes?
I think diet is 80% for diabetics. So
Yes.
if you are controlling your diet and if you're moving a little bit also, I mean, I hope there is nothing really wrong that you can't move. But I hope, let's say you have something on the lower body which is a problem and you can't move around, so use your upper body. If you can't move the upper body, use your lower body. If you can't move at all, then please focus on the diet, which is 80%. Make sure you're having low carb foods. Make sure you have enough protein to maintain your muscle mass and the sugar levels. Make sure you're eating enough fiber. So if you're not moving around, you could also have constipation. And make sure you do include good amounts of nuts and fats in your diet, so that you can have more satiating food intake. And actually, again, the same rule applies: low carb, good protein, good fats.
Yes. Thank you, ma'am. Thank you very much for that question. See, people have the myth like if they do exercises only, they can reduce the diabetes or even weight loss. So,
Not really.
as you rightly mentioned, 80% diet plays 80% role in reducing all the chronic diseases like diabetes and weight loss or obesity.
Mm-hmm.
So, and 20% plays exercise, physical activities actually. Yeah.
Yes.
Yes. So I will move on to the next last question, madam, by Basha. So, what is the best food and schedule of eating food for a diabetic patients because he's having a three times a meal and due to busy schedule? I
Okay.
think yeah.
Yeah, Basha is a very, very, very good question. I think a lot of people are under the myth of having 5 meals a day, or having, small meals. So if you're a busy person, I don't think you can do that. So if you're having 3 times a day food, and in between fasting period is at least 3 to 4 hours, and it's perfect for diabetes also, unless you are on a medication that will bring your diabetes or your blood sugar down. Make sure you're not on those medications, because when you have a fasting period, you tend to become, low blood glucose levels. So if you are having 3 meals a day, make sure they're, use the plate method, where there is three-fourth of the two-third of the plate is vegetables and fiber, and one-third is protein, and one-third is your complex carbohydrate. Complex carbohydrate, I mean something which is whole grain, something which is fiber, not like maida, not something which is processed. So if you're going to have 3 meals a day, make sure you use the plate method, and plate method is available everywhere on Google. Just Google it and use that kind of strategy to maintain your sugar levels, because in between meals, when you're not going to have anything, you need a good amount of protein to balance that out. So proteins are the single most good macros to maintain a blood sugar level. They will not bring your blood sugar level down. So make sure that every meal that you have has protein in it, whether you're vegetarian or a non-vegetarian.
Yeah. Okay, ma'am. So that's a generic question, and which will help us for all the, not only for Pasha, it will be very helpful for other users as well. So I have one more question from Miss Aruna, ma'am.
Mhm.
She's having vascous vein. And she's asking, can vascous veins can be controlled by walking and diet, and fruits and vegetables which I have to take to control diabetes. And with the fruits like papaya, she can control. She's having a acidity, man. Like there
Okay,
are,
there are a lot of questions in this question.
yes, ma'am. Yes, ma'am.
I think
There
I
are,
will start with the first question.
yes, ma'am.
Varicose veins. Varicose
Varicose.
veins are something that are due to lack of venous return to your heart. So if you are somebody who is standing a lot and has a that kind of job, you need to wear stockings. And of course, movement is very important. Move, move, move. And as far as diet is concerned, there is not much you can do with diet in varicose veins because it's poor venous circulation. I think movement is very important, and make sure that you raise your legs sometimes in the day and sit, and don't always have them hanging down. Those are the lifestyle changes that you can do. But as far as food is concerned, you always need to have good, a very balanced food, good proteins, good fats, good complex carbohydrates, and that rule applies for everybody, whether you're diabetic or not. And did I miss out on something? Because there are three questions in one.
Yes, ma'am. Like the second question is fruits and vegetables which
Okay.
I have to take to control diabetes. She's asking what
Fruits and
any,
vegetables.
yes, ma'am.
Yeah.
What kind of
For
fruits and vegetables?
diabetes, I think fruits are overrated. I think you should have low glycemic index for fruits. Something like papaya is good. She asked about papaya. Papaya is fine. Guava is fine. Pomegranate, green apple. Those are good fruits to have.
Yeah.
And in vegetables, I think all the non-starchy vegetables are great. Lot of greens, a lot of loki, a lot of that family of vegetables is very good. If you have too much potatoes, peas, carrots, and be careful because they're high in glycemic index. And the fruits that you should not have as a diabetic are extremely the ones which are very high in sugar, maybe like custard apple and very very ripe fruits. Two very ripe fruits like banana and all can increase blood sugar, although I feel banana is a great food, but be careful. If you have uncontrolled diabetes, you can raise blood sugar.
Yes, ma'am. So she's also asking if she eats papaya, she's getting acidity. So if that fruit is giving acidity, they should avoid it.
Yeah. Anything
Yes,
that
ma'am.
gives you acidity, you're the best doctor of your own body. You
Yes, ma'am.
recognize the symptoms of everything that happens. I think you should just listen to your body and see that if something is not working out for you, then it's not for you.
Yeah, ma'am. And someone is asking how Nutrifil is uh, help to prevent diabetes, ma'am. Like I think that question I can answer it. If you sign up to our Nutrifil using WhatsApp chatbot or our mobile application, we within 24 hours we will our nutritionist will call you and provide you the customized diet plans based on your health condition. Your health condition might be weight loss or diabetes or cholesterol controls or triglycerides. As of now, we are focusing on these four areas. So we will provide you the customized diet chart for you. And not only 1 week, within the next weeks, if you have a medical report with you also, we will examine that report also. But having said that, we are providing only nutrition side suggestions only, not pharmaceutical. Following with your medicines as well, your pharmaceutical. Along with that, we will control your diet as well. So that's how we will help you to prevent your diabetes. Actually, as Dr. Anjali Hudagaru also said that diet is plays very key role in controlling all the cardiovascular or chronic diseases. Yes, ma'am. Ma'am, I think any last few words from your end, ma'am? Like,
Well, I would say that people are suffering a lot from diabetes, and I think it's important to get it diagnosed on time. Even if you are pre-diabetic, don't ignore it, because a lot of people say, oh, maybe next blood test I can do this and something magical will happen. And there's no magic. You have to control it. You have to make sure that you're eating good food, be mindful eater, make sure that food is medicine instead of popping pills later on. I think right now, if you can improve your food habits, I think that would be the best thing that you can do for yourself. And as far as once you become a diabetic and you are going to face the problems of diabetes, like a lot of people said, numbness, and there could be eye problems, there could be cataracts, there could be kidney damage. So to control all that, I think food is number one. Don't depend on medications always. And if you are on medication and you're also trying to control your food, some people will be on high medication, they don't want to control their food. Make sure that you are talking to your physician at the same time, so that you are bringing down the medication need as you go ahead in your health journey. So make sure that you're always under somebody, some licensed practitioner's supervision.
thank you, ma'am. Thank you for your
Sorry
valuable.
to interrupt, Veera. One more
Yeah,
question we got.
yeah.
We have any proven cases on diabetes? Okay. So yeah, some people have joined the Nutriful program and they have shared their health reports, and we are doing weekly consultations with them, and time to time suggestions we are giving to them. And their we collected their HbA1c levels and some fasting glucose also. So some people got benefited and that levels get to normal. So you can also, if anybody wants to do correction of their health program, they can also join and they can also benefit of this program. Thank you.
So even one more question, last word came, ma'am. So even for prevention of diabetes, what are the health screening tests the Mr. Test he is asking? So that is general body checkup and HbA1c for every 3 months, and before and after fasting glucose sugars are good enough to monitor your
You can,
uh,
if you are already a diabetic, one important test that we miss out is microalbumin of urine. You want to see that, the microcirculation of kidney has got damaged, so you can control it by medications initially, and also eye checkups every year.
yes,
Retinal checkups where they dilate your eyes and you can't see, and then, the doctor will look in the retina. So
yes,
retinal damage also can be looked at early on. So eye checkups, microalbumin urine, and if your creatinine rises, your kidney functions are anything, something happens, make sure you also get a nephrology consult.
yeah. Thank you, ma'am. Thank you very much for that question. I hope Mr. Charan got the answer from madam. And so, ma'am, thanks for your time and your valuable time and your valuable insights. I hope our Nutriful audience got your valuable insights, and we would like to continue sessions like this in future. So please sign up for Nutriful, and uh, we will be in touch with you and provide you more sessions like this, useful sessions.
Thank you. Thank you,
Thank you.
everyone. Thank you, Balaji. Thank you, Veera, and thank you, Shanti, everybody who's
Thank you.
facilitated this session. Thank
Yes,
you very much. I look forward to more educative knowledge.
yes, ma'am. Yes.
Thank you.
Thank you. Thank you.
Bye.
Bye.